Dr. Menares, I agree with you completely that we need to restore trust in public health. But in order to do so, we have to have a discussion about the actual science, and we can't have a discussion of this, is about all vaccines are good, all vaccines are bad. This is about specific vaccines, it's about specific age groups, it's about specific policies. Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce viral load in individuals who are
Does it prevent transmission?
When you have reduced viral load, you will have reduced transmission.
But in other words, it doesn't prevent transmission. You can still transmit the virus if you've had the vaccine. In fact, there's been reduced ability to interfere with transmission over time. And what we've found is the most recent one since Omicron is down around 16% reduction, if there is a reduction. Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't. The statistics are inconclusive, and the reason you can't prove that it does is there's so few people under 18 that go to the hospital. The numbers are extraordinarily small. There's like 76 million kids under 18 in our country. 183 died, and a few thousand went to the hospital in 2020 and 2021. And since then, the numbers have dropped precipitously, and the idea and the issue needs to be discussed. But the COVID vaccine is not reducing hospitalization. It's not statistically significant. Does the COVID vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't, and there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it. When they approved it, they had this discussion at the vaccine committee that we've been talking about. During the discussion, they acknowledged that there was no proof of reduction in hospitalization or in death. So what they did is they said, what can we use to try to make people take this vaccine? They came up with this. They said that if we give you a COVID vaccine, you make antibodies. So really the whole recommendation for having a COVID vaccine from 6 months up is not based on hospitalization data, not based on deaths. It's based on whether you make antibodies or not. And what people fail to see from this is I can inject you with a foreign protein every week and measure your antibodies. You'll make antibodies every time. It just means immunology work has nothing to do with whether you should get a vaccine every week. So when we're discussing the science here, we have to discuss what is the science in favor of giving a vaccine to a 6-month-old and what are the benefits from that. And there is no benefit of hospitalization or death. And then what would the risks of the vaccine be? We have large population studies of the risks of the vaccine in younger people. And it turns out that you don't see this as much if you look at the general population, but once you start isolating in by age group, which you have to do in COVID because there's such a disparity among age group, you find that there is a risk of myocarditis, a significant event. It's somewhere between 6 and 8 in 10,000. But that's much greater than the risk of hospitalization or death, which are not even measurable because they're so small. So you resisted firing people who have this idea that the COVID vaccine should be at 6 months. That's what this is about. You didn't resist firing the beautiful scientists that are career people and unobjective and unbiased. You wouldn't fire the people who are saying that we have to vaccinate our kids at 6 months of age. That's who you refuse to fire.